Today we're diving into a topic that affects everyone, hormones. These tiny chemical messengers with a big impact on our mood, weight, energy and overall health. And here to help us understand hormone imbalances is Dr. Mark. Now Mark, we hear the term hormone imbalance. What does it actually mean in our bodies?
Michael, it's when there's too little or too much production of certain hormone. But what we need to understand is that hormones are chemical messengers, and they're produced in one part of the body and then they circulate and they have an effect on a different type of tissue or on a different hormone. When I speak to hormone imbalances to my patients, I actually talk about the symphony of hormones. So think if you're sitting in an orchestra and one of the instruments is out of tune, it's playing too loudly, or you can't hear it at all, your overall experience of the music starts to decrease. And with our hormones, it's exactly the same. It's this big orchestra and it needs to be orchestrated, and there's different things involved: the hypothalamus, pituitary gland, the adrenal glands, your pancreas, and many more.
Okay.
And if one of them are not working, then it creates a cascade problem throughout the body.
Okay. Mark, this next question I suppose is a little bit broad, but help us to understand, like, what would be the symptoms that we would experience if there is an imbalance in hormones, and how do they differ from how we might experience other disease or issues in the body?
Michael, the symptoms are actually quite subtle. I think the most obvious one for women in any case is changes in their menstrual cycles.
Okay.
And then we have the other ones: hair loss, one; sleep disturbances, a distressed gut, fatigue, and a lack or a change in sexual functioning and libido. So those are the common ones, but you know what, they can also be described or ascribed to other conditions.
Right.
And that's what makes this a little bit difficult.
Okay. Now you mentioned that for women it might be a change in your menstrual cycle. Are the symptoms, obviously some are distinct, but are some of them quite similar in men and women, or do they really differ?
Actually, you know, there's quite a big difference. Women have a normal cyclical hormone variation through their menstrual cycles. Their hormones change on a continuous basis. Men actually have a far shorter one. Their hormones change on a daily basis.
Okay.
But women's decline rapidly, for instance, where men will have a steady decline. It really depends on which hormone system we're looking at.
Right.
And I think when people hear the word hormones, they think of female hormones, menopause, night sweats. Men will think about their wives when they hear hormones. And when we think about male hormones, we think about testosterone. But there's over 50 hormones that we've identified. Cortisol, insulin, ghrelin, leptin, you know what, there's a myriad of them. So it's not just the ones that we are so familiar with. I think one of the ones that people often forget is thyroid.
Yes, right, absolutely. So Mark, now in terms of testing for hormonal imbalances, this is, if you've got some symptoms, you want to check it out, is this a specialist test or is it quite a run-of-the-mill standard experience?
Michael, no, it's I almost want to say box standard blood test.
Okay.
You test insulin, you test your thyroid, but there's different types of thyroid hormones that you will test. Obviously, you test your sex hormones like estrogen, progesterone, testosterone, but we can also test cortisol levels and we can test other hormones.
Okay.
So it's normal tests. It's not really super specialized.
Yes.
Unless you go into really nitty-gritty stuff.
Okay. And in terms of lifestyle and medical history, does this come into account when making a diagnosis around hormones?
Absolutely.
Okay.
Absolutely. The cornerstone of making any kind of diagnosis is taking a proper medical history. And not just a medical history of a patient themselves, about previous conditions, previous surgeries, medications that the patients are taking, but also a family history. When there's a family history of thyroid disease, of diabetes, etc., etc., it can guide you. For women, polycystic ovarian disease, if your mother had this, there's a big chance that you might have it. And, then there's other conditions, certain types of cancers. It will help and guide us when we decide what treatment protocol we're going to embark for someone with a strong family history of certain conditions.
Okay.
So the cornerstone of any diagnosis is always a good history, because the history that you have, the history that your parents and your grandparents had, can and most probably will affect the outcome or the condition that you're having and the treatment that we can consider.
Okay. Now, Mark, we've spoken in the past about hormones and their impact on brain function. I mean, can hormonal imbalances be linked to things like depression, anxiety, brain fog?
Absolutely. Michael, I think earlier I mentioned thyroid hormone. So if we take a look at the importance of the thyroid hormone, the thyroid is responsible for metabolism. Okay? So thyroid hormones, T3, T4, are also responsible for brain metabolism, what gives the brain energy. Estrogen, testosterone, all of those have effects in the brain. Estrogen is associated with anti-inflammatory action in the brain. Testosterone elevates dopamine levels in the brain. So when there's a change in the hormones, it often leads to mental changes or a decline in mental functioning.
Okay.
Alzheimer's, Parkinson's, dementia is strongly associated with a decrease in estrogen specifically.
Okay.
So progesterone repairs nerve tissue, so does estrogen and testosterone. And that can have a decline in cognitive function, which leads to anxiety and depression.
Okay.
Or there's not enough energy, thyroid.
Okay.
So absolutely, if there's mental changes, the first thing that you need to look at is what is happening with the patient's hormones, and it doesn't happen.
Okay. Now, Mark, I think a lot of people associate hormonal changes with age. Is this something that is primarily the cause, or is it lifestyle and age? I mean, can hormonal imbalances happen early on in life?
So lifestyle changes, yes. Hormonal changes happens because of sedentary lifestyle, stress, etc. Stress most probably one of the big factors. But I think that one that we are forgetting is medications. So we create hormonal changes for any woman on any kind of contraceptive.
Okay.
And that has a knock-on effect. So we'll give you a oral contraceptive. It's going to suppress your testosterone, which is going to lower your libido, decrease energy. So that's just for women in their reproductive years. Now, pregnancy will change it. Menopause will change it. So it's not just age. Medical conditions, medication, lifestyle, sleep, one of the big things that will change hormone balances. And you cannot discount stress, and all of us have high levels of stress.
Absolutely.
So it's an absolute combination of literally everything that you do and don't do, take, don't take, that can have an effect.
Okay. Now, Mark, next week we're going to unpack the treatment options that are available and protocols, but just give us a sense of what different kinds of treatments are available for this condition.
Michael, it really depends on which hormone system we are working. Again, I think most people think about menopause and andropause, testosterone, estrogen. So there you have modalities ranging from oral medications, transdermal medications, transvaginal medications, or even implants. Thyroid, one of the other ones, this is oral medication usually, but we're starting to differentiate on which type. Insulin is one, cortisol, where we need to do lifestyle changes, optimize with maybe corticosteroids from time to time. So there's too many hormones to say, you know what, there's a specific treatment that you will do. There's different modalities. Safety of hormone replacement depends on the different types that you use, whether it's oral, transdermal, as I said, mucosal, the length, duration, chronic conditions. So it's really, really complicated.
Okay. Mark, anyone watching at the moment who thinks they'd like to sort of have a consultation, find out more, understand what's going on in their own bodies, how can they get hold of you? Remind us once again.
The easiest to get hold of us on 010-824-1393. That's the phone number for the practice here in Johannesburg. We're available on www.thetclinic.com and on social media.
Wonderful. Mark, look forward to chatting further on this next week. Thanks for joining us.
Thanks, Michael.